Hi there, Dr. Gary here on the road. We are dental practice brokers nationwide. Today's topic is going to be for the sellers. Attention sellers. Dramatic demographic change in 18 months in one town. We'll talk about what happened. Anyway, we are now in 27 states. We have 27 states. We have 10 employees. Have doing the dental practice brokerage nationwide 12 years now. I practiced for 25. Everything you're about to hear is for informational purposes. It is for, it's not legal or business advice. Our phone number is 201-663-0935, and our website is nationwidedentalpracticebroker.com or dentalpracticeguide.com. If you're a seller that wants to sell to a large group like a DSO, please remember we're independent. We can pick and choose who we work with, but often the DSOs will pay our commission, so there'll be no commission to you. And sometimes based on criteria, we can get your legal fees reimbursed upon successful closing. Now, we're available to you 363 days a year. We take off Christmas and Easter, and we'll be available from 7:30 a.m. East Coast time to 9:30 p.m. So call us. If you have something you want to talk about, we'd be happy to. So what happened? In 18 months, there's a dramatic demographic shift, socioeconomic, in a town that was more of a kind of a resort town, but had a lot of full-time residents. This town, in 18 months, the crowd changed. Now, the doctor had been doing quite a bit of fee-for-service, and especially in this summertime, did have a large influx of summertime residents, and therefore had multiple, good percentage of fee-for-service patients. For whatever happened, and I don't know why it happened, but within 18 months, the socioeconomic, demographic, it was a shift. And although he was doing quite a bit of fee-for-service, he had to change to a mostly fee-for-service and a PPO to a highly PPO clientele and minimal fee-for-service. The practice changed demographically in 18 months. Yes, once again, this is a go-to destination in a town, and it is kind of a resort town, but still a lot of patients, very busy in the summertime, and that changed. So you can't just assume, well, I had a great year for the last 31 years, and I will bank on that. I'll make the same amount of money. I'll have the same demographics as I did for the past 31 years. Because I often hear sellers tell me, well, my accountant says all I have to do is work another year and a half and I'll make the same money and then I could just sell in a year and a half. Doesn't work like that all the time. And this is a specific example of what happened. Complete demographic shift in 18 months. Now population is different. Now it's not making as much. Now the net has changed. And everything they base the practice on as far as their delivery, 1 hour for treatment plan presentations, it's all changed. There is no consistency. And I see it and I'm experiencing it right now. So for those sellers who say, don't worry, I'll work another year and a half and I'll make the same money and I'll just sell in a year and a half or 18 months later. It doesn't always work that way. Also, you can have disability, things change. We just went through a dramatic pandemic. If that hasn't woken you up, I don't know what will. But these things do happen, and you've got to be aware of that. So just giving you information on a day-to-day basis, how things can change, and dramatically, this one doctor's practice changed in 18 months. So be aware of that. All right? Great talking to you, and thank you for listening. And we have many more videos coming. I think we are like 183 now, YouTube videos. So I hope you find these things educational. We try to give it to you as it breaks, and I hope you enjoy listening. Thank you. Bye.